How can I assess my personal breast cancer risk effectively? Understanding your personal breast cancer risk is an important step in making informed decisions about your health. It helps you and your healthcare provider determine the best screening and prevention strategies. Several scientifically validated tools can help estimate your risk accurately. One of the most commonly used tools is the Breast Cancer Risk Assessment Tool, also known as the Gail model. It was developed in 1989 and has been updated over time. This model estimates your risk of developing breast cancer over the next 5 years and your lifetime risk up to age 90. It takes about 5 minutes to complete and can be done either in your healthcare provider's office or online. The Gail model has been validated for women of different racial and ethnic backgrounds, including white, Black, Hispanic, and Asian women in the United States. However, it has some limitations for certain populations, especially those with extensive family histories or known genetic mutations. The Gail model considers 7 key risk factors. These include your current age when you started your periods, age at your first childbirth or if you have not had children, family history of breast cancer among first-degree relatives like your mother, sister, or daughter, the number of past breast biopsies you have had, whether any biopsies showed atypical hyperplasia, and your race or ethnicity. It's important to remember that most risk factors only modestly increase your risk. For example, genetic mutations like BRCA1 or BRCA2 are associated with a much higher risk, but they are less common. Women with a 5-year risk of 1.67% or higher are considered high risk according to Food and Drug Administration guidelines. This threshold can help determine if you might benefit from additional screening or preventive measures. But keep in mind that these tools are estimates, not crystal balls. They cannot tell you exactly who will develop breast cancer. Some women with higher risk scores may never develop the disease, while others with lower scores might. If you want a more detailed assessment, other models like the Tyrer-Cuzick, BOADICEA, or IBIS models might be more appropriate. These models often provide a deeper look into family history and genetic factors. For example, the Tyrer-Cuzick model considers family history, personal health history, and other factors like lifestyle. The Rosner-Colditz model adds considerations such as alcohol use, age at menopause, and weight, which can influence risk. These models are especially useful if you have a strong family history or are concerned about hereditary risk. It's also important to know the limitations of these tools. They are less accurate for women under 35 or those with certain high-risk factors like previous invasive or in situ breast cancer. They also don't work well for women with family histories involving relatives with ovarian or prostate cancers linked to genetic mutations. Plus, they cannot predict with certainty who will develop breast cancer. They are best used as guides to help you and your healthcare provider understand your risk level. Talking with your healthcare provider is key. They will review your medical history, reproductive history, and family history of breast cancer to estimate your absolute risk. If your risk level isn't clear or you have a strong family history, your provider might refer you to a genetic counselor. This specialist can conduct a more comprehensive risk assessment, including detailed family history and possibly genetic testing, after thorough counseling and informed consent. Knowing your risk helps you and your doctor decide on the best next steps. This might include starting screening earlier, choosing different imaging tests like MRI or ultrasound, considering medications that can lower risk, or making lifestyle changes such as maintaining a healthy weight, exercising regularly, limiting alcohol, and avoiding smoking. Remember, these tools are just starting points. They should always be used alongside professional medical advice tailored to your individual situation. Always consult your healthcare provider to interpret your risk assessment and to develop a personalized plan for your breast health.